Number 11, the Honourable Annette King.
My question is to the Minister of Health. What recent reports, if any, has he received on an increase in pressure on DHBs and health professionals in providing health services in New Zealand?
Honourable Tony Ryle.
Mr Speaker, I've received a wide range of recent reports, including a number of DHB annual plans, which for the most part reflected increased provision of publicly funded health services and increased funding. We want New Zealanders to receive the best possible health care, and we do put pressure on boards to deliver this. We've increased health operational funding by an average of around $500 million a year, but as the Minister knows, or the member knows, and has said herself, it has always been and will continue to be an ongoing challenge for DHBs to live within their means.
Supplementary question, Mr. Speaker.
Question, the Honourable Annette
Has he been informed of nurses working at Starship Hospital for 15 hours a day because of nursing shortages at that hospital, only being paid for 12 hours and told not to record 15 hours on their timesheets? And if he hasn't been informed, will he investigate the nursing shortages and overwork at Starship before children are put at risk?
Honourable Tony Ryle.
Mr Speaker, if that member has that information, please make it available to me. I would have to check the information in light of previous claims made by that member, but the latest information I have is that our nursing staff at the county's Manukau DHB is up some 400 in the last 8 years.
Point of order, Mr Speaker. I think the Minister
Point of order, the Honourable Annette King.
I think the Minister might have misheard. I said Starship, not Counties Manukau.
That is not a point of order. Supplementary question, Honourable Annette King.
Point of order, Mr Speaker. Well, in light of his answer then, he did not address the question. I mentioned Starship, not Counties Manukau.
Order. There were two parts to the member's question. The question was addressed. I invite the member to ask further supplementaries.
Has he been informed of growing pressure faced by GPs, which has led one to write on Tuesday this week that GPs face, quote, a whole tsunami of issues with DHBs, including not having basic access to ENT, dermatology, neurology, renal services, ultrasound, orthotics, timely discharge summaries, etc., etc., and that the Minister's targets are often set with minimal or no recompense. If so, why is this occurring in light of his claim that general practice is better off?
Honourable Tony Ryle.
Well, Mr Speaker, I would have to check the veracity of that member's claim because I am aware of some documents that have been doctored in order to justify some of the press releases of the member. But what I would say to that, in fact, our government has put a lot of extra money into primary care. We have increased, for example, the ability of GPs to refer patients directly for diagnostic tests without having to go through a specialist. We've also improved the access that GPs have to refer their patients to specialists. And as I said in my question earlier in the House today, we've had a really significant boost in the number of first specialist assessments, which is really the gateway to additional services that GPs often refer to.
Well, supplementary question.
Supplementary question,
well, in
the
light of that answer,
King.
has he seen a copy of the letter that DHBs are now sending out to patients who have been referred to a specialist by their GP, which reads, quote, unfortunately, your clinical priority is such we're unable to offer you a specialist appointment within the current resources and capability, even though the person's condition could include osteoarthritis of a major joint with significant pain and restriction, or significant functional loss and pain, and patients being told their conditions must be urgent before they can get an appointment.
Mr Speaker, I would have to verify those claims. They could be like the claim that the member put out recently that people were...
Mr Speaker.
Point of order.
Mr Speaker, on 3 occasions he has been doubting the word of me as a Member of Parliament, and that I thought you might have pulled him up on that.
This is a point of order. The member can start her point of order again.
My point of order is, Mr Speaker, on 3 occasions now, or perhaps it's 4, he has doubted my word as a member, saying he has to check my figures or the veracity of what I'm providing. I'm prepared to table the letters in a moment, but I find that unacceptable. He should answer the question.
Well, no, I don't need the assistance. No, I don't need the assistance of the Leader of the House. Can I ask the member, Honourable Annette King, to look at Speaker's Ruling 1656? The Minister being questioned is perfectly at liberty to dispute the quote. That is the risk that members take when they include a quote in a supplementary question that has not been validated. And that was a ruling recently given by the Honourable Dr. Lockwood Smith.
Mr. Speaker, you want an answer?
Mr. Speaker?
Did the member not?
No, he just said he doubted my word, so I got the answer.
Okay, supplementary question.
Supplementary question. Does he think refusing 35% of orthopaedic patients referred by their GP for a first specialist assessment at Waitemata DHB in this last year because of the level of funding provided gives them better, sooner, more convenient health care? If so, how?
Mr. Speaker,
Tony
as the member knows, Waitemata has provided more orthopaedic service for patients in their area. The member knows that. Some patients have been referred and have been unable to be provided with an appointment, but that's always been the case. And as I said earlier on in the piece, the activity and the ability of DHBs to provide more services for their patients has been increasing quite dramatically.
Point of order, Mr. Speaker.
Point of order.
I seek leave to table the information from Waitemata DHB, which shows that 35% of orthopaedic patients in this last year were refused a first specialist assessment.
And he wants the table that document. Is there any objection? There is none. It can be so tabled.
Supplementary question, Mr.
Supplementary
Speaker.
Question, Honourable Annette King.
Has he seen a copy of the letter DHBs are now sending out to patients after they receive their first specialist assessment, something that he was wanting to boast about today? A letter that reads, "You have been recommended by your surgeon for surgery, although it is clear you would benefit from surgery and your surgeon and your GP would prefer this happen now. It's not possible to provide it to you at this time because of limitation of resources." So could the Minister explain why it's good news to get an appointment, a first specialist appointment, to tell them that they need an operation, and then to receive a letter that tells them you're out of luck?
Honourable Tony Ryle.
Because, Mr. Speaker, and I can't believe this question was asked, 40,000 more people are getting operations this year than in 2008.
Order, Mr. Speaker.
What's happening is...
Order. I apologise to the Minister. I point.
There's nothing about what happened in 2008. I asked him if he had seen a copy of the letter.
And we don't
I read
need
out what was in the letter.
We don't need the question repeated. The question, in essence, was, has the Minister seen a copy of the letter? Honourable Tony Ryle.
Mr. Speaker, I haven't seen a copy of that letter, but I'd have to check because I have seen press statements and documents that members distributed where the figures provided were doctored.
And that is absolutely rubbish. Point of order, Mr. Speaker.
Point of order, Honourable
I
Annette
seek
King.
leave to table a copy of the letters that are being sent out from district health boards telling people they can't have their operations.
That's all that's needed. We've had the letter quoted to us. Leave us sought to table that letter. Is there any objection to that course of action? There appears to be none. It can be so tabled. Question number 12, Katrina Shanks.
Thank you, Mr. Speaker.